I'm excited about today. I'm sharing my presentation with you from around, I won't say where, I don't want people to get jealous this morning. Right, Brother Rob? But it's such a pleasure to be able to be with you for this morning. So I'm continuing my topic on HIV. We did talk about what is HIV last week. We talked about the different diagnosis, the different signs and symptoms, and so I'm going to continue with some other topics as relate to that. We also did cover how you can get tested and how easily that can be done. So let's continue. So we talked about how HIV is spread, but I will go back over that a little bit. And that's by having sex, by sharing needles. It can also happen through blood transfusions. But today, we have improved quite nicely on how blood transfusions and how blood and products are screened before it's administered to patients. During pregnancy, of course, or delivery, or through breastfeeding. What are some of the complications? So HIV infection weakens your immune system, making you much more likely to develop many infections and certain types of cancers. So some of the complication infections common with HIV is what's called PCP, and that's the pneumocystis cystis pneumonia. This is a fungal infection that causes severe illness. Although it's declined significantly with current treatments, in the US, PCP is still the most common cause of pneumonia in people infected with HIV. Candidiasis or thrush is a common also HIV-related infection. It causes inflammation and a thick white coating on the individual's mouth, tongue, esophagus, or even their vaginal area. Tuberculosis is also a common opportunistic infection associated with HIV. Worldwide, TB is a leading cause of death among people with AIDS. It's less common in the US thanks to the wide use of HIV medications. Cytomegalovirus, this common herpes virus is transmitted in bodily fluids such as saliva, blood, urine, semen, and breast milk. A healthy immune system inactivates this virus and it remains dormant in your body. If your immune system weakens, the virus resurfaces, causing damage to the person's eyes, digestive tract, lungs, and other organs. Also, cryptococcal meningitis. Meningitis is an inflammation of the membranes and fluids surrounding the person's brain and spinal cord. Cryptococcal meningitis is a common central nervous system infection associated with HIV, caused by a fungus found in soil. And there's also toxoplasmosis. This is a potentially deadly infection that's caused by Toxoplasma gondii, a parasite spread primarily by cats. So infected cats pass these parasites in their stools, which may then spread to other animals and humans. Toxoplasmosis can cause heart disease, and seizures occur when it spreads to the brain. Other complications: cancers common with HIV, lymphoma, Kaposi sarcoma, and HPV-related cancers. We also have wasting syndrome. Untreated HIV/AIDS can cause significant weight loss, often accompanied by diarrhea, chronic weakness, and fever. Neurological complications: HIV can cause neurological symptoms such as confusion, forgetfulness, depression, anxiety, and difficulty walking. HIV-associated neurocognitive disorders can range from mild symptoms of behavioral changes and reduced mental functioning to severe dementia, causing weaknesses and inability to function. Kidney disease: HIV-associated nephropathy is an inflammation of the tiny filters in your kidneys and remove excess fluids and waste from your blood and pass them to your urine. It most often affects Black or Hispanic people. Liver disease is also another complication. Starting and maintaining treatment. Everyone with HIV infection, regardless of the CD4 T cell count or symptoms, should be offered antiviral medications. Remaining on effective antiviral medications with an undetectable HIV viral load in the blood is the best way for persons to stay healthy. For the ART to be effective, it's important that the person take the medication as prescribed without missing or skipping any doses. That's important. Keep the immune system strong, reduce your chances of getting an infection, reduce your chances of developing treatment-resistant HIV, and reduce your chances of transmitting HIV to other persons. What's the treatment for HIV? While HIV cannot be cured, modern therapies and treatments are available that can help people with HIV live long, healthy lives. The medications given a combination of 2 or more medications from several different drug classes. This approach has been the best chance of lowering the amount of HIV in the blood. There are many ART options and combined with multiple HIV medications into one pill that's taken once daily. Staying on therapy can be challenging, so it's important to talk to your healthcare provider about possible side effects, difficulty taking medications, and any mental health or substance use issues that may make it difficult for you to maintain and stay on your treatments. The classes of anti-HIV drugs are non-nucleoside reverse transcriptase inhibitors. They have the nucleoside and nucleotide reverse transcript inhibitors as well. And these are all the newer meds that are being used today. Other classes is protease inhibitors, integrase inhibitors, and entry or fusion inhibitors as well. HIV 101, I want just to remind everyone about how it is transmitted. We already discussed that. It is not transmitted by air or water. Some people are afraid to hug other people or to kiss them on the cheek or, to touch them or to use the same utensils. I mean, it's the way that I wash my fork before I give it to someone else. It's the same precautions that is taken, right? It's okay to get tested. There's nothing wrong with that. There should be no stigma for that. Living with HIV. Living with HIV, some of the topics that people tend to talk a lot about is, being newly diagnosed, understanding their care, understanding their treatment, understanding opportunistic infections that they can catch. Telling others, that becomes a little intimidating and overwhelming for that individual to speak to others because they're afraid of how people may start treating them. Protecting others is key if you are diagnosed. There's a lot of stigma as it relates to HIV, and that's something that we need to educate ourselves more on so we can stop stigmatizing others, whether it's with HIV or anything else. Living healthy life, people can live healthy lives with HIV. Planning with your family, traveling. If you have HIV, you can travel just like everyone else. You just need to make sure that you take the proper precautions to protect yourselves from catching anything or even infecting others. Along with receiving medical treatment, it's essential to take an active role in your own care. The following suggestions may help you stay healthy longer. Eat healthy foods. Make sure you get enough nourishment. Fresh fruits, vegetables, whole grains, and lean protein help keep you strong, give you more energy, and support your immune system. Avoid raw meat, eggs, or more. Foodborne illnesses can be especially severe in people who are infected with HIV. Cook meat until it's well done. Avoid unpasteurized dairy products, raw eggs, and raw seafood such as oysters, sushi, and sashimi. Get the right vaccinations. Take care with companion animals. Supplements that may be helpful. Acetylene L-carnitine. Researchers have used this to treat nerve pain, numbness, or weakness in people with diabetes. It may also ease neuropathy linked to HIV if you're lacking in the substance. Whey protein and certain amino acids. Probiotics, vitamins, and minerals. Your vitamin A, D, E, C, and B, as well as minerals, zinc, iron, and selenium may be helpful if you have low levels of them. Talk to your healthcare provider first, as too much of some vitamins and minerals can be harmful as well. Coping and support. Receiving a diagnosis of any life-threatening illnesses is devastating. The emotional, social, and financial consequences of HIV/AIDS can make coping with this illness especially difficult, not only for you, but also for those closest to you. But today, there are many services and resources available to people with HIV. Most HIV/AIDS clinics have social workers, counselors, or nurses who can help you directly or put you in touch with people who can. Services they may provide include arrange transportation to and from healthcare providers, help with housing and childcare, assist with employment and legal issues, provide support during financial emergencies. It's important to have a support system. Many people with HIV/AIDS find that talking to someone who understands their disease provides comfort. I want to give special acknowledgement to the Mayo Clinic, HIV.gov, hivcare.org and the CDC for this information that I provided to you. If you have any questions, please join us in the Zoom. I'll be happy to answer your questions for you. Thank you. God bless from the island of Jamaica. Have a wonderful day.